Here this morning, so thank you for being here today. We really welcome your presence and your attention, your time this morning. I'll be presenting Senate Bill 1368 in the Senate Education Committee. This bill will require that sexual health education curriculum for middle and high school students be updated to include information about licensed pregnancy centers. It also directs the Department of Education to include information about pregnancy centers on its website. Updating this content will give students more information and more choices. The bill would not replace current curriculum or remove existing resource information from instruction or the Department of Education's website. It simply brings into parity the resources offered to students, giving them information on both Planned Parenthood and licensed pregnancy centers. Students should have access to all available information because if they find themselves facing an unplanned pregnancy or another reproductive health issue, they'll be better prepared to make decisions about their future. California licensed pregnancy centers provide comprehensive care and judgment-free environment for women, their partners, and their families. Pregnancy center staff are trained to counsel and assist young women when they are at their most vulnerable. These centers offer a variety of free services to women and couples who want to make informed choices about unplanned pregnancies. Medical services provided by licensed clinics include urine pregnancy test, ultrasound examinations, medical referrals, prenatal vitamins, STI and STD testing and treatment, and early prenatal care. However, these centers go beyond by also supporting families through counseling, supportive health services, and adoption resources. By also providing maternity clothing and baby supplies such as diapers, baby wipes, formula, clothing, blankets, and so much more. Pregnancy centers are able to support our most vulnerable communities. I have seen firsthand the work of these pregnancy centers in my district. Thank you, Kathleen Jones, and at Life Choice Pregnancy District, at Life Choice Pregnancy Center for working with me on this legislation. But let's allow the statistics to speak for themselves. In 2019, pregnancy centers in California provided services and materials valued at more than $14.3 million, serving 93,957 women, men, youth, and families. There were 33,802 free pregnancy tests, 22,264 free ultrasounds performed by registered nurses and medical sonographers. 4,571 total STD, STI tests performed by RNs, 77% female and 23% male. These medical services totaled $7,341,844, but were free of charge for our communities. The free materials items have also made an impact, providing a total of 187,127 total free baby items to families in need. 56,100 packs of diapers, 31,931 packs of baby wipes, 97,176 new and used baby clothing outfits, 1,180 new car seats, 740 new strollers. All of this is made possible by the amazing staff behind these centers, 2,579 of whom are completely volunteers. I'm grateful for the strong support the bill has received from licensed pregnancy centers across the state. We need more reproductive health care providers, especially in rural areas, low-income areas, and people of color. I'm going to also share the remarks I'm also going to share some remarks in Spanish today. But let me finish the one part in English as well. Many women know where to get an abortion, but most women don't know that free resources from pregnancy centers exist. Please join me in supporting SB 1368 this morning in Senate Education Committee because students receiving state-mandated education deserve to know all available options so they can make fully informed decisions about issues surrounding their sexual health. With diverse options, we create informed futures. And thank you. Buenos días y bienvenidos a todos. Esta mañana presentaré el proyecto de ley del Senado conocido como SB 1368 en el Comité de Educación del Senado Estatal. Este proyecto de ley requiere que el plan de estudios de la educación sobre la salud sexual para los estudiantes de la secundaria y preparatoria se actualice para incluir información sobre centros de embarazo autorizados por el Estado. También ordena el Departamento de Educación que incluya información sobre los centros de embarazo en su sitio web. Actualizar este contenido brindará a los estudiantes más información y más opciones. El proyecto de ley no reemplazará el plan de estudio actual ni eliminará la información de recursos existentes de la instrucción o del sitio web del Departamento de Educación. Simplemente ofrece a los estudiantes más recursos, brindándoles información tanto sobre Planned Parenthood como sobre los centros de embarazo autorizados. Los estudiantes deben tener acceso a toda la información disponible porque si se enfrentan a un embarazo no planificado u otro problema de salud reproductivo, estarán mejor preparados para tomar decisiones sobre su futuro. Los centros de embarazo autorizados de California brindan entornos afectuosos y libres de juicios para las mujeres, sus parejas y sus familias. Los personales de estos centros de embarazo están capacitados para asesorar y ayudar a las mujeres jóvenes cuando se encuentran en los momentos más vulnerables. Estos centros ofrecen una variedad de servicios gratuitos a mujeres y parejas que desean tomar decisiones informadas sobre embarazos no planificados. Los servicios médicos proporcionados por clínicas autorizadas incluyen pruebas de embarazo, exámenes de ultrasonido, referencias médicas, vitaminas prenatales, pruebas y tratamiento de las enfermedades de transmisión sexual, infecciones de transmisión sexual y atención prenatal temprana. Sin embargo, estos centros van más allá de esos servicios. También apoyan a las familias a través del asesoramiento, servicios de salud, de apoyo y recursos de adopción. Al proporcionar ropa de maternidad y artículos para bebés como pañales, toallitas para bebés, fórmula, ropas para bebés y mucho más. Los centros de embarazo pueden apoyar a nuestras comunidades más vulnerables. He visto de primera mano el trabajo de estos centros de embarazo en mi distrito. Gracias a Kathleen Jones de Life Choice Pregnancy Center por trabajar conmigo en esta medida. Pero permitamos que las estadísticas hablen por sí mismos. En el 2019, los centros de embarazo en California brindaron servicios y materiales valorados en más de $14.13 millones, atendiendo a 93,957 mujeres, hombres, jóvenes y familias. Se realizaron 33,802 pruebas de embarazos gratuitas, 22,264 ultrasonidos gratuitos realizados por enfermeras registradas y ecografistas médicos, 4,571 pruebas totales de ETS y ITS realizadas por enfermeras registradas, 77% mujeres y 23% hombres. Estos servicios médicos ascendieron a $7,341,844, pero fueron gratuitos para nuestras comunidades, gratuitas. Los artículos materiales gratuitos también han tenido un gran impacto, proporcionando un total de 187,127 artículos gratuitos para bebés y familias necesitadas, 56,100 paquetes de pañales, 31,931 paquetes de toallitas húmedas para bebés, 97,176 conjuntos de ropa de bebé nuevos y usados y 1,180 sillas de auto nuevas. 740 carriolas nuevas. Todo esto es posible gracias al increíble personal que se encuentra detrás de nuestros centros. 2,579 de los cuales son completamente voluntarios. Estoy agradecida por el fuerte apoyo de SB 368. Ha recibido de centros de embarazo autorizados a través de todo el estado. Necesitamos más proveedores de atención de salud reproductiva, especialmente en áreas rurales, áreas de bajos ingresos y para personas de color. Muchas mujeres saben dónde acudir para tener un aborto, pero la mayoría de las mujeres no saben que existen recursos gratuitos en esos centros de embarazos autorizados. Únase a mí para apoyar la medida de SB 1368 esta mañana en el Comité de Educación del Senado, porque los estudiantes que reciben educación obligatoria por el Estado merecen conocer todas las opciones disponibles para que puedan tomar decisiones completamente informadas sobre cuestiones relacionadas con su salud sexual. Con opciones diversas, creamos futuros informados. Muchísimas gracias. I would like to now introduce our first speaker, Kathleen Jones, Chief Executive Officer at Life Choice. Life Choice Pregnancy Center is a state-licensed community medical clinic in San Bernardino. I had the chance to visit and learn more about the services it provides. Kathleen is also a board member of the California Alliance of Pregnancy Care. Thank you, Kathleen.
Thank you, Senator, and good morning. My name is Kathleen Jones, and I am here in support of SB 1368. I'm proud that the Senator chose Life Choice Pregnancy Center as a sponsor for her bill. I would like to acknowledge and thank Senator Ochoa Bogh for her heart and passion for educating the youth of California. Life Choice Pregnancy Center, as well as other pregnancy care centers affiliated with California Alliance of Pregnancy Care, are fully committed to educating, informing, and guiding students regarding human development, sexuality, pregnancy, contraception, and sexually transmitted diseases and infections. Life Choice Pregnancy Center has been providing education and resources to the community in and around San Bernardino since 1973. It became a licensed community medical clinic so that we could provide extended services to meet the growing needs of those in our community. For the past 50 years, Life Choice has been a staple in San Bernardino and Riverside counties, focusing on the ever-changing needs of moms, dads, and families that visit us year after year. We partner with many other community organizations like Black Infant Health, Dignity Health, and Sunrise Life Development to provide necessary and vital assistance to people of all ages, backgrounds, and cultures. Life Choice Pregnancy Center consistently provides needed free services and material resources for over 3,000 couples annually. Our staff includes educators, medical and business professionals, in addition to our nearly 50 staff of volunteers from a myriad of backgrounds and expertise. Life Choice has and is committed to providing the highest level of care for the next 50 years. Thank you again, Senator, and I'm proud to join you this morning in sponsor of 1368.
Thank you, Kathleen. Next, I would like to introduce Kelly Bradford. Kelly's a mother of two beautiful daughters. She has first-hand experience with licensed pregnancy centers and their vital services. Thank you.
Good morning and thank you. My name is Kelly Bradford, and I have had 5 abortions. Unfortunately, when I was growing up, I was misled and told that Planned Parenthood was the only place for me to go to receive care for my unplanned pregnancies other than the hospital. When I went there, the only service I was offered was an abortion. Not one time did they speak to me about continuing my pregnancy and providing prenatal care, support, or adoption services. When I heard about Alternatives Pregnancy Center and others like it, I was blown away by the quality of care they provide and the time they take with each patient to go over their options when faced with an unplanned pregnancy. But I was also baffled because I didn't even know pregnancy centers existed when I needed help. Through my experience with Alternatives Pregnancy Center, I've personally been able to meet other women who have asked the same question as me. Where were the pregnancy centers when we needed them? But because of Alternatives, I have received prenatal care when I needed it and healing through their abortion recovery class. SB 1368 is such an important bill to me because my own daughter, who's in the 8th grade, will be going through sex education this year, and I pray that she and her peers will be educated on all the resources available to them that this bill provides. We all deserve to know all of our options, and pregnancy care centers provide vital information that we need to make the best decision for ourselves and our unborn child. It's only fair and just that we give our students all options, and Planned Parenthood alone is just not doing that. So, Senators, I urge you to do what's right to make these resources available to our youth so they don't make the same mistakes or decisions I did. Thank you.
I'd like to introduce Jeanette Kuhn now. Jeanette Kuhn is the CEO of Birth Choice Centers and president of the California Alliance of Pregnancy Care. With more than 10 years in the pregnancy care industry, Jeanette is passionate about providing excellent care and support for those with unexpected pregnancies. Thank you, Jeanette.
Right there, sorry. I'm ready, thank you. Hello, my name is Jeanette Chun, and I'm the CEO of Birth Choice Centers and the current president of California Alliance of Pregnancy Care. I'm thankful to be speaking here today on this topic that I deeply believe in. The inclusion of pregnancy centers is a viable local resource for teens and young parents being added into the educational arena. It is vital to the community and our students. Pregnancy centers offer amazing resources that allow students to receive education and assistance at no cost. Almost all of our centers are not-for-profit organizations that do not receive any financial gain from the client's decisions, which allows our only aim to be healthy outcomes for our clients. The youth should be given all of the options available to them so that they can make the best decisions for themselves and their sexual health. Our pregnancy centers not only provide confidential services that allow for people to come to us privately, but they can avail themselves of the extensive services that give them every opportunity to have positive reproductive health outcomes. It is vital that we have resources available to the community and our youth that allow for equitable access to all modalities of help available. The excellent training and robust community relationships and resources that most pregnancy centers provide goes far beyond what one would expect and leaves very little that we can't assist our clients with. If we don't provide a service, we absolutely can share referrals for who does so that they are well cared for and treated holistically. As experts in our field, pregnancy centers being given inclusion into this educational arena will allow diversity of information. This information empowers the students to make fully informed decisions for their sexual health. Pregnancy centers are exemplary in pregnancy prevention discussions and allow students the space to share their needs and questions in a safe and pressure-free environment. The vast array of no-cost or free services that pregnancy centers offer is not only an incredible resource to the state and the local community, but should be a welcome addition to any school district who is looking to have the education that students need and deserve. The financial savings to the state as well as local school districts would be immense. Local resources that have no financial gain provide unbiased information that will bring nothing but a positive impact in all aspects of the student's education and sexual health outcomes. Thank you.
Next, I would like to introduce Angela Cox. Angela is a licensed registered nurse and a public health nurse certified in California. She's here today on behalf of and is an employee of the Sacramento Life Center and the Sacramento Valley's Women's Health Clinic. Thank you.
Good morning. I am happy to be here today on the behalf of and as an employee of the Sacramento Life Center and the Sac Valley Women's Health Clinic. We are a licensed community clinic, licensed by the California Department of Public Health since 1998. Additionally, we are accredited by AAAHC and have been since 2017. AAAHC assists healthcare organizations to provide the highest achievable level of care for recipients by updating existing standards to reflect cutting-edge ambulatory care knowledge and practice. AAAHC is one of only a handful of prominent nationwide accreditation organizations for U.S. healthcare facilities. Sac Valley Women's Clinic chose to go through this optional yet arduous process to become accredited because we wanted to provide our patients with only the highest standards of care and safety. Our credentialed medical team consists of OBGYN physicians, a nurse practitioner, licensed registered nurses, and RDMS licensed sonographers. At our clinic, we provide at no cost to our mostly low-income women clinical grade pregnancy testing, limited obstetric ultrasound exams for viability and dating, STD testing, education and treatment for both women and men, assistance with the Medi-Cal eligibility process, resources to help with food, housing, clothing, and other financial needs, pregnancy, childbirth, and parenting classes, free pap smears and associated labs. Again, all of our services are free and confidential. We have helped thousands of women in our 52-year history. Annually, we serve nearly 2,000 women each year and at no cost to them. We look forward to continuing to serve the needs of this community in the years to come. Thank you, Senator, for inviting us here this morning.
Finally, I would like to introduce Cindy Cleveland. Cindy has been a registered nurse for 26 years. Her background is in emergency and critical care nursing. She's currently the clinical lead nurse at Alternatives Pregnancy Center, where she has served the Sacramento region for 2 years.
Good morning. My name is Cindy Cleveland, and I am the clinical lead nurse at Alternatives Pregnancy Center. Alternatives Pregnancy Center has been a fully licensed medical clinic for over 20 years, and we've been serving women in the Sacramento area for over 42 years. I have been a critical care nurse for 26 years, and I've worked in 7 different hospitals and clinical settings. Every day, I am amazed and impressed by the level of personalized and professional medical care women receive at our clinic and others like it throughout the state of California. It is this professional and high-quality care that is above and beyond any hospital or clinic that I've ever worked in that I'm so proud of. At Alternatives, all of our patients are well cared for by a staff of board-certified physicians who specialize in OBGYN, family medicine, and radiology. We also have licensed nurse practitioners and a staff of registered nurses. Our registered nurses have an average of over 15 years of clinical experience. We also staff phlebotomists and medical assistants, and this is common practice amongst pregnancy centers in California. At Alternatives, we provide pregnancy tests, limited obstetric ultrasounds, STI and STD education, testing, and treatment. We also provide prenatal care up to 25 weeks for the women in our clinic. Each of our patients get an hour with our OBGYN, our nurse practitioner, and our medical assistant. As well, they leave each appointment with tangible resources such as prenatal vitamins, diapers, wipes, baby food, baby items, and resources and education on healthy pregnancy habits and healthy nutrition. But what I'm most proud of is our objective, non-biased, peer-reviewed medical education that we provide women on pregnancy outcome options, including parenting, adoption, and abortion procedures. In my work as a critical care nurse, I saw hundreds of times that doctors provided informed consent to patients as they were about to undergo a medical procedure. This informed consent included thorough education on what the procedure was, risk factors, benefits, and possible side effects. Almost every day, women walk into our clinic after going to an abortion provider not having received this informed consent. They tell us when they were taking the chemical abortion pill that all they were told is to take these pills and you will have a heavy period. When given true medical education on how chemical abortion medications work, the women in our clinic are surprised and thankful, as no one has taken the time to share with them how these medications work in their bodies and what the risks and possible side effects are. And pregnancy center care does not end there. We continue to care for women who are struggling post-abortion. We have counselors and staff who help women who are emotionally struggling with their abortion decision. We literally put women back together emotionally and spiritually who have been hurt by their abortion experience. Alternatives and over 175 pregnancy centers like it in California are providing this care, this professional and compassionate care, free of charge. Women every day ask us why. Why are you doing this for us? Why are you giving us such excellent care and free of charge? It's because Alternatives and every pregnancy center in California truly believe that women deserve the best, most accurate, most professional, most personalized, and most high-quality care possible. So thank you, Senator, for SB 138 and including us in the resources that public school students will get for their sexual education.
Thank you, Cindy. In conclusion, today's press conference has highlighted the invaluable contributions and personal stories from those deeply involved in providing support and medical services to those facing challenging pregnancy decisions. From Kathleen's leadership of Life Choice to Kelly's courageous sharing of her personal experience and Jeanette's passionate advocacy, we've gained insight into the essential role that licensed pregnancy centers play in our communities. Angela's and Cindy's professional perspectives further underscore the critical healthcare services these centers offer for sexual health, pregnancy, and most importantly, beyond. I just wanted to share how grateful I am and honored to be able to work in this capacity as state senator representing my district in Senate District 23. One of the beauties about the job that we have as legislators is the ability to learn what is available to our community members. And it is most importantly for me personally to instill everything that I've learned into my constituents, to let them know and facilitate conversations, understanding, and awareness. This bill today, SB 1368, allows me to share with my constituents and all of California the opportunities, the resources that are available in their communities. So help me support this measure today in Senate Education Committee. And thank you for being here today. Oh, yes, sir. I think that when we have diverse options and choices, we have diverse futures and more informed futures, right? It's important to let them know that there's so much available to them that they may not be aware. And as adults, when something is not fully there, when something is broken, we have the power to change it. And this morning, we have the power to change that, to allow our students to be fully informed so they can have better futures tomorrow.
Just a quick follow-up, it seems especially relevant given the governor's press conference later this morning, which is essentially making California a sanctuary state for abortion. Any comments on that?
Just the fact that we are allowed, we should have opportunities for information across our state. This is just a complementary opportunity for us to be working alongside, not as an adversary, but complementary. Okay. Okay.
Anything that you want to drop, you can put on social media.